We have been using ultrasound right since our department started in around 2010, and basically we started using it initially for doing our nerve blocks and for vascular access.
So the advantage of this technology is that we know exactly where we are going, how we are going, so that we can easily avoid causing any unintentional collateral damage to such vital structures.
We had a lot of small children who used to come for vascular access, and these were patients for chemotherapy, bone marrow transplant, having low platelets with a tendency to bleed. So using the ultrasound gave us a good success rate and reduced the chance of complications in these children.
And it also increased the rate of procedural accuracy by almost 100%.
Nerve blocks with the help of ultrasound has, in these group of patients again who have a chance to bleed and are on anticoagulants, we have to give less pricks, and the success rate is much higher and the outcome of surgery is much better in these patients. A third group of patients where we are using it is in thoracic surgery patients, which is a highly specialized surgery, and in this we need to isolate the lungs. Ultrasound helps us to decide whether the lung has collapsed or not. So and then we are also using the ultrasound to see the neck in difficult airways. We can identify the vocal cords, the trachea, whether it is going to be a difficult airway for us. That is another area where we have started using the ultrasound. With the help of point of care ultrasound, we have seen that our incidence of complications has reduced over the years, like pneumothorax and arterial puncture. That is much less. Then when we look at using it in nerve blocks, the success rate is much higher. It's almost as high as 97 to 99%.
I have been utilizing it for different head-to-toe clinical applications. Ultrasound has become a handy tool for real-time visualization of aeration of lungs during recruitment maneuver in the mechanical ventilated patients.
We have Edge in our hospital, which we have been using for last so many years, and we are very happy with the results. It gives me an additional vision or a very important tool or aid to enhance my practice, to increase its efficacy, to reduce the complications associated with the procedures, at the same time increase the success rate.
I am using a Sonocyte M Turbo Color Doppler ultrasound system in my department for last 8 years. This machine is very user friendly, sturdy, and can be sanitized easily to prevent any cross contamination. It is very portable and is easy to move from one patient to another patient in ICU. The Sonocyte India team is quite amicable and continuously providing academic support for our various ultrasound courses. After the introduction of point of care ultrasound in our practice, it expedited procedures and prevented the possible accidental organ damage in all the cases.
A patient who is met with a massive trauma or accident comes with multiple broken bones and is in tremendous amount of pain. Now this patient may need to undergo so many investigation and tests before we can take him up for corrective surgeries. In the interim period, patient does not need to suffer from pain, so we use this technology to put some nerve blocks so as to alleviate the pain of the patient and make the wait more tolerable or less suffering.
As compared to the traditional technique, ultrasound increased the first attempt success rate of procedures from 65% in a traditional technique to almost 100% by using ultrasound. There is a significant reduction in bleeding complications with ultrasound guidance, resulting in the reduction of the length of stay of patients. Bedside ultrasound has changed the way of management of critically ill patient. With bedside ultrasound, it is very easy and quick to identify the cause of acute change in the physiology of patient and to monitor the response to the given therapy.
Before the ultrasound guidance in our clinical practice, with the help of just anatomical knowledge and landmark based techniques, our success rates used to hover around 70 to 80%. But now that we have this excellent technology, we can safely or we can proudly say that the success rates have gone up to more than 95%.
At present, we have Sonocyte M Turbo and Edge. These are very sturdy systems, user friendly, and we have been using it over the years and they don't really have any maintenance problems. So the cost is also very less, over the period of years.
We all know that, especially in the West, in the US, There is a huge issue of opioid misuse, abuse, and we are not far behind. If you go to areas like Punjab, again it's a big problem even in our country. So with the help of this technique, we can reduce the use of opioids or narcotics. So that's a big advantage. With the help of ultrasound, we have been able to devise newer blocks which were previously unheard of, like facial plane blocks which were not in existence before the advent of ultrasound, are now coming with the excellent reports so far that there is enhancement of safety, enhancement of efficacy, and less complication rates.
I believe that point of care ultrasound is an invaluable tool from head to toe assessment which should be adopted by all critical care physicians in their routine practice for enhancing patient safety and satisfaction. It has got a very small learning curve. If initially one may feel it is little complicated, but once person starts using it, it becomes a way of life in everyday practice.
Overall impact is that the patient goes back a happier patient, a more satisfied patient.